Hello dear aquarist, welcome again to one of my videos, and today I have something special for you because I will talk about the most important fish diseases in cichlids. Yes, the cichlids, which are a very popular item for many of you, so I made special attention for you on this cases of diseases I found during my profession as a fish doctor, encountering diseases, trying to diagnose correctly, and trying to give the correct medications. So I will give you some advice here. Please listen to this video because you see the 5 most important diseases in cichlids, and I give you suggestions how to handle it and how to treat it, so you'll be a more happy cichlid lover. So let's start by sharing you my PowerPoint. And the most important diseases in cichlids also provided you subtitles for your language in English, French, German, Spanish, Portuguese, Hindi, and other ones I selected for you. So check in the subtitles of this YouTube video. So the 5 most important diseases in our cichlids, where I'll talk about the African cichlids and the South American and Central American cichlids. Of course, first of all, we know bloat or dropsy and secondary bacterial infection. Yes, very common. Spironucleus, that used to be called Hexamita, an internal parasite. Fish tuberculosis or bacterial infection. Worm infections, external and internal worms. Skin and fin lesions due to aggression. Well, that's according to my findings of 5 important, well, maybe most important, maybe not for you. Well, you can leave your suggestions or replies at questioning my findings, and maybe you have other diseases. So let's show you some videos and some photographs. Well, first of all, I show you a photograph of one of my big books where I talk a lot about cichlid diseases. Yes, I have specific chapters on African cichlids with all different photographs and explanations on the diseases. Also in South American and Central American and discus. Yes, you call it, I have it all in that big book. And the first of all we discuss today is bloat or dropsy. And here you see 2 pictures of bloat with Malawi cichlids. You can see the big bellies, protruding anus. Well, some of you might have seen that. And dropsy, well, look at the dwarf cichlids there with the Popeye, the raised skellies. That's an Apistogramma here, McMastery. And here the angelfish, also a big belly, protruding eyes, and some fin rot. Well, that's cases of dropsy. Well, bloat and dropsy, well, what are the signs and the symptoms? Well, we know, you can see it, you might have the experience. It's a swollen belly, sometimes protruding anus and Popeye, raised scales. Particular raised scales is a case in dropsy or ascites. It's an accumulating of fluids in the abdomen because the kidneys are not working well. Then we also have a red base at the fins, pectoral or dorsal fins have a red base. Well, the possible causes, you might be aware, maybe you don't know, but usually it's bad food or poor feeding practice. I talk a lot about that in my videos. You can follow on my videos on nutrition and fish health. Might be a risk that parasites are involved. There might be also secondary bacterial infections, and usually in many cases I found bacterial infections. So that's the different problems you can have. And how to handle this? Well, bloat and dropsy, check the food and your feeding practice and how you keep the food or how healthy the food is, how it's well maintained, not too old, not too many pathogens. I have a lot of videos on that, so watch my videos. And of course the microscope. Well, I'm a fish doctor. I can tell you it helps you to determine what the real problem is, or an expert can advise you. Treatments, well, you have to treat antiparasitic and or antibacterial. Possibly it's fish tuberculosis. I will talk further on my case, well, the most important fish disease number 4, fish tuberculosis. And see my books. I give you a lot of information on the kind of treatments you can handle. Number 2 for the cichlids, well, you know, it's the parasite Spironucleus, used to be called Hexamita, common in angelfish, and here in this Eulidochromys ornatus, a Tanganyika cichlid. Well, you can see it here on discus fish. They start to get dark in color, separating, and that's how it starts in the beginning. Later on, they got whitish excrements, they got sometimes holes in the head. Well, that's the first thing you have to do, is check the excrements of these kind of sick discus fish. Well, see here the discus fish starting showing patches, or here the uaros with bad fins and getting skinny. Well, that's all caused by Spironucleus. Also can cause hole in the head disease, like on this Tilapia butycophrae. Look at the holes in the head. In many of my cases, I found that Spironucleus is part of the problem of the holes in the head. Or a skinny Euludochromys. Here, the Euludochromys leuloipi. Well, caused by parasites. And the parasites, that's how it looks like. It's a little animal in the gut, in the intestine, damaging the wall of the intestine and causing a bad absorption of minerals, vitamins, and nutrients. So that weakens the fish and gives a risk of many possible secondary infections, particularly bacterial. So what can I advise you as a treatment? Well, first of all, improve the conditions, give good food, avoid stress, check the parameters. Try to treat with an appropriate medication like metronidazole or something similar. Ask in your pet shop. There's many good products available. Use a better food, a food that is functional, like our Dr. Bassleer biofish food, Lapacho, which helps in curing and regenerating the fish and repairing. Sometimes antibacterial treatments, when advanced infections occur, are needed. You know, I'll explain that in my videos on hole in the head disease or head and lateral line syndrome. See my videos on YouTube. I do not recommend to treat every month for Spironucleus. It's no use. You can risk resistance of the parasite. Only treat when it's necessary. We do it for humans, also do it for your fish. Only treat when it's necessary, please. Fish tuberculosis. Number 3, Mycobacterium. See the skinny Labros calvus, or this obliquidens Haplochromys species. Look how skinny and bad it look. Here the Ramirezi, different, pop high, big belly. Well, that looks like a kind of dropsy, but it isn't. It's a Mycobacterium, which can cause a kind of dropsy look or kind of bacteria. Or here the wasting away, thin, dark discus. Well, Mycobacterium. A Mycobacterium, it's in the organs, causing tuberculosis that damage here the kidney, organs badly damaged. That's our symptoms you see, or signs you can see when you use a microscope. And you can send it to the laboratory, or you can use gram staining techniques. This helps you to define if it's a gram positive bacteria that can cause it. Mycobacterium. Many different symptoms. Unfortunately, we cannot define one typical symptom how Mycobacterium fish tuberculosis looks like. The fish are slowly wasting away, can take months or years. The origin is usually by the food. It can come from frozen or live food. Also frozen food contains Mycobacterium, can contain. And some food are dangerous, like we have noticed in scientific studies done on mosquito larvae, bringing in Mycobacterium bacteria. And the mother fish pass it on through the gonads, through the eggs of the fish. So the mother fish is the carrier and a potential transmitter of the disease. And it's mostly caused by breeders. Breeders who don't take care, not good actions, not preventative actions, because you need to prevent. Because treatment, well, not much you can do. You have to separate the fish, sometimes putting it to sleep in a gentle way with euthanasia. Prevention here is better than cure, so particularly talk to your breeder. He has to take good actions, and I give a lot of advice about this in my books. Number 4 on important diseases on our cichlids is gill flukes, a worm infection. Look, common on Oscar fish from breeders, or angelfish from breeders suffering with gill flukes, or internal worms, the discus fish with internal worms, or this Malawi cichlid with internal worms. And you can find it how? Well, using a microscope. So that correct diagnosis determines a correct treatment. Here you see the internal worms, the nematode, Capillaria, And here the gill flukes that look like dactylogyres. Easy to determine when you use a microscope, and that's what I use. And number 5, last but not least, lesions or damage caused by aggression. Well, you know, cichlids can be aggressive, particularly when they lack good food or when they don't have a good territory, not a good system you're keeping in the aquarium with wrong species mixed together. Ask your pet shop for good advice what you can keep together and how to keep the fish well. So here you see the damage, the lesions on this Pseudotropheus, and here on this Equidens species, well, you can see the bad lesions, all caused by aggression. Then bacteria come up as a result. Well, then you have to treat antibacterial, but first of all, avoid the aggression. So you can see, as I showed you, our eyes are limited, so we need a microscope to make a good diagnosis, and that can help you, or an expert can help you. And you can learn more details and treatments from my books available on the link which I show here below. Subscribe to learn more. Thank you for watching this video because it might have taught you something. And I have more videos to come on the most important diseases in discus, angelfish, scalari, dwarf cichlids, apistogramma, Oscars, Malawi cichlids specifically, and diseases specifically on Tanganyika cichlids. Okay, that was it about the cichlids. So I thank you for watching, and I hope you as a cichlid lover or fish lover, doesn't matter, everybody who keeps fish has well understood what I explained. If not, write a comment. If you have some remarks to make on diseases you encounter, write it in the comments, and I'm interested to see what you all bring forward. So keep in touch, subscribe to learn more about fish disease. Thank you for watching.